In this video, we'll discuss about quality management in blood banking, blood bank quality management. In this one, we want to discuss internal quality control of reagent and solutions, internal quality control of blood component, equipment calibrations, internal quality control of test for transmission transmitted infections, then document control, external quality assurance, then hemovigilance, hospital transfusion committee, internal audit, management review meeting, quality indicators. So all the topic we want to discuss one by one. These are the steps of transfusion. Some of them are inside and some of them are outside the blood bank. First of all, there is decision to transfuse the patient with blood or blood component. Then requisition is sent to blood bank along with the blood sample of patient. The request is processed by blood bank according to the standard operating procedures. Then the component or blood is collected from the blood bank and maintaining the cold chain is transferred to clinical area. Then there are free transfusion check. Free transfusion checks, then active transfusion and monitoring of transfusion, then recording of transfusion, audit and preference, audit and performance improvement. So these are the some steps of transfusion. What are the steps? In and outside blood bank, these are the steps, some of them inside and some of them outside. What are the steps? Decision of transmission to patient with blood or blood component, then requisition is sent to that blood bank, then the request is processed by blood bank according to the standard operating procedure. Then the component or blood is collected from the blood bank and maintaining in the cold chain is transferred to that clinical area. Then transfusion, monitoring transfusion, recording transfusion, and then performance improvement. So these are the some of the steps of transfusions. Then good manufacturing practice, quality control and audit program, all are closely linked together. These are the requirement of quality management system. These are very similar to that a clinical laboratory. So its component are origination and management, accommodation and environment, personal equipment, external service, supplies and reagents, process control, identification of deviation and adverse effect, performance improvement, document control, record, internal audit and management review. So quality management system, good manufacturing practice, quality control and audit program. closely linked together. Requirement of QMS, quality management system requirement, organization and management, accommodation and environment, personal and equipment, external service, process control, identification, performance improvement, document control, record, internal audit and management review. Introduction. Blood center shall main quality assurance to ensure that the product produced are fit for their purpose. They are free from infection risk and they containing required bioactive substances to provide clinical benefit. Internal and external quality control should be carried out to ensure that the test performed are as per the protocol and the result obtained are reliable and reproducible. So, internal and external quality control shall be carried to ensure the test performed for the protocol and result obtained are reliable and reproducible. The process is documented. The record of all quality control should be maintained. That means the process is documented. Now, what is IQZ? Reagent and solution. The this is the recommended frequency of testing for reagent solution, either they are done each day or before each run. So internal quality control reagent and solution, this is recommended frequency of testing for reagent and solutions, either they are done each day or before each run, each day of use or before run. Anti-human globulin serum each day of use. Then this reagent red cell for antibody screening each run. All reagent shall be checked for expiry date and used only when within the date. Let's see the internal quality control for bovine serum albumin. The reagent shall be free of the non-sporing agglutinin and shall not reacted with saline suspensions of ABO cell. So this bovine serum albumin, the reagent shall be free of the non-specific alignates, non-specific alignate and shall not reacted with saline suspensions of ABO. Next, enzyme reagent. These are the enzymes used in blood bank for detection of incomplete antibodies, and enzymes shall be liquefied and stored in frozen state. Only required amount for the daily use shall be through the unusual enzyme remaining at the end of each day shall be discarded. The unused enzyme shall be discarded. Next, normal saline and buffered solution. The solution shall be checked daily for pH between 6.7 to 7.2. Absence of hemolysis with random A, B, and O shall provide useful indication for its suitability. Next, reagent red blood cell. There shall be a pool of 3 individual cells for each group. Cells shall be prepared daily and shall be free of hemolysis. Each batch of reagent cells ABO for serum grouping prepared shall be tested to confirm specificity. Either commercially available or prepared in house panel shall be in use. The red shells shall be stored frozen at 4 degree. The red cell stored for more than 48 hours at 4 degrees Celsius shall be checked for reactivity of at least 1 week reactive antigen by saline and indirect antiglobulin test. These are the quality stand for reagent red cell and this is the normal saline. Reagent red cell and normal saline parameter quality control, frequency of control, appearance no hemolysis, frequency of control daily each day, reactivity and specificity positive reaction with known sera against RBC antigen, quality control of normal saline each day. Then quality control of normal saline appearance, no turbidity each day, pH 6.0 to 8 each new batch. Then hemolysis, a mixture of 0.1 ml of saline and 0.1 ml of 5% of red cell suspension centrifuged after 10 minutes, no hemolysis each new batch. ABO and anti-D reagent, a vial of every new batch checked it potency, that is titer, specificity and avidity of receipt. All the antisera and other reagent used for serological work in blood bank checked daily for their specificity and avidity using known positive and negative control. All reagents showing turbidity and discoloration. Contamination shall be discarded. Manufacturer package insert titer, avidity, and all other relevant information. Methods followed manufacturer instructions. At any given time, different patches of anti-D reagent available either from two different manufacturer. Anti-B, anti-Zera, acceptance criteria for titer, specificity and avidity for anti-B monoclonal reagent. These are the reagent. anti-A, anti-B, anti-AB, anti-serum, all the nodes attached. Then anti-human globulin reagent, one vial from every new batch. Checked its specificity and reactivity using IgG coated cell. Each test include positive and negative control. Non-sensitized ABO cells are checked to rule out non-specific reaction. All negative anti-human globulin reagent test shall be confirmed by addition of IgG coated cell in the test. Next, acceptance quality of anti-globulin reagent parameters, quality reagent, frequency of control. Then IQC blood component should have adequate medicinal value. They should free from bacterial infection. Frequency 1% of all unit or 4 per month, whichever is more. Summary of whole blood hematocrit raised more than 30 percentage. Leukocytes depleted component less than 5 percentage. 10 raised to the power 6 per unit. Packed red cell hematocrit 65 to 70 percentage. Then platelet concentration RDP, that means random donor platelet, more than 3.5 into 10 per unit for 350 ml into 4.5 into 10 per unit for 450 ml. Then platelet concentration STP, single donor platelet, this one more than 3.0 into 10 raised to the power of 11 per unit. FFB, stable coagulation factor as assayed by PT and APTT. Then the standards for blood component attached.